The latest efforts to update the classification criteria for juvenile idiopathic arthritis, JIA, stem from the recognition that the existing International League Against Rheumatism, ILAR, criteria, which divide JIA into 7 subtypes, do not fully capture the complexity of the disease. The new classification system, proposed by the Pediatric Rheumatology International Trials Organization, PRINTO, aims to improve the categorization of JIA by using an evidence-based approach and focusing on clinical and routine laboratory measures available globally. The revision is part of a broader effort to better distinguish between forms of chronic arthritis that are typically seen only in children and those that can extend into adulthood. To achieve this, the classification process involves several stages, including the analysis of data from over 1,000 JIA patients, followed by consensus conferences among international experts. The goal is to refine the criteria to ensure more homogeneous groupings of patients based on clinical presentation, which could enhance both diagnosis and treatment strategies. This ongoing work reflects advancements in understanding the disease's etiology and aims to address the clinical diversity of JIA by establishing more biologically distinct categories 6, 7 source. The new PRINTO classification for juvenile idiopathic arthritis, JIA, aims to improve upon the existing ILAR classification system by addressing its limitations, such as the overlap between categories and the lack of focus on the underlying biology of the disease. Key aspects of this new classification include 1. Evidence-based approach. PRINTO uses a rigorous, data-driven approach to redefine the JIA categories. This involves gathering clinical data from over 1,000 patients at disease onset and analyzing this data to refine the classification 7 source. 2. Focus on global applicability. One of the main goals of the new classification is to ensure that it can be used universally, regardless of the resources available in different countries. This means relying on clinical features and routine laboratory tests rather than advanced or region-specific diagnostics source. 3. Consensus building. International consensus is central to the new classification's development. Printo has organized consensus conferences involving experts from around the world to ensure that the final criteria reflect a broad range of clinical experiences and perspectives. 7. 4. Clinical and laboratory measures. The new classification places significant emphasis on routine clinical assessments and basic laboratory tests that are widely accessible. This ensures that the classification is practical for everyday use, especially in resource-limited settings 7 source. The revision process is ongoing, with additional studies and analyses planned to finalize the criteria. The ultimate goal is to create a system that better captures the diversity of JIA while remaining clinically useful. The PRINTO, Pediatric Rheumatology International Trials Organization, has developed a new proposed classification for juvenile idiopathic arthritis, JIA, which significantly revises the older ILAR system. This new classification was driven by the need to create more homogeneous clinical categories that better reflect both pediatric-specific conditions and forms that are similar to adult diseases. Here are the proposed categories under the new PRINTO classification. 1. Systemic arthritis, expanded to include patients with systemic features like fever but without arthritis, aligning it with adult onset Still's disease. 2. RF-positive arthritis, now incorporates anti-CP antibodies, providing a more specific connection to its adult counterpart, rheumatoid arthritis. 3. Enthesitis spondylitis-related JIA. This category has been adjusted to reflect the features of adult spondyloarthropathies. Number 4. Early onset ANA plus arthritis. This is a new category recognizing children with asymmetric arthritis, typically before age 6, often ANA positive, and prone to chronic uveitis. These patients were previously spread across several ILAR categories. 5. Other JIA. This category includes cases that don't fit into the above categories but meet the broader definition of JIA, arthritis lasting for at least 6 weeks. 6. Unclassified JIA, for cases that meet criteria for more than one of the categories mentioned above. This revision has also done away with some older categories, such as oligoarthritis, polyarthritis, and psoriatic arthritis, as these were found to be less useful for classifying homogeneous entities in children. The PRINTO classification is currently undergoing validation through prospective studies 17 source. Yes, the new PRINTO classification of JIA is likely to influence the management approach in several ways. 1. Targeted therapies. The refined categories are more closely aligned with underlying disease mechanisms. This should allow for more targeted therapies, similar to those used in adult forms of the diseases. For instance, the differentiation of systemic JIA from other forms of JIA may prompt earlier use of biologics such as IL-1 or IL-6 inhibitors, reflecting its similarity to adult onset Still's disease, 16 teen source. 2. Early identification and treatment. The creation of the early onset ANOS arthritis category may lead to earlier identification and treatment of children at high risk for chronic uveitis. This could involve more proactive monitoring and the use of specific therapies to prevent complications. 17 source. 3. Streamlined treatment algorithms. With more homogeneous categories, treatment algorithms can be simplified. For example, recognizing that enthesitis spondylitis related JIA is similar to adult spondyloarthropathies could lead to more consistent use of TNF inhibitors, which are standard in treating adult patients. AT&T source. 4. Long-term prognosis. The ability to more accurately classify JIA could improve long-term outcomes by ensuring that patients receive appropriate treatments early in their disease course, potentially reducing the risk of joint damage and other complications. Overall, the new classification aims to create more precise treatment strategies based on the biological and clinical characteristics of each JIA subtype. This will likely lead to a more personalized and effective approach to managing the condition.